Good morning, everyone. I'm Joe Robinson from the Department of Public Health, and I'm the Director of Behavioral Health Services. We're very pleased that you're here with us today to help us launch this much-awaited program. And I'm very honored that Mayor Lee could be here with us today. He has been incredibly instrumental in helping San Francisco become the 5th county in California to implement this program. Mayor?
Thank you. Thank you. Well, good morning, everyone, and welcome to one of our important sites in San Francisco where a lot of important work is being done, and this happens to be a large division of our Department of Public Health, particularly focused on our psychiatric services. And thank you, David, for giving us the tour, and Joel for allowing us to see staff at work. As you can see this morning, it's a lively group of people here that are seeking services. But what we are announcing today is something that Supervisor Farrell and I have been working on for some time. And as soon as we knew that we were going to get passage, we started working the details, the nuts and bolts on how to communicate with our public, particularly families of individuals that perhaps have gone through our criminal justice system and our emergency medical systems more than once, to allow them to play a role with us and with the judges and with our justice system and our community court system, perhaps to offer yet again I think a more compassionate approach to people who are dealing with mental illness. And of course, a lot of people are reporting in, and we see now a reflection in that as people use our newly refreshed 311 application, as well as our connections to our public health facilities to report people in to see if we can get health checks out on the street, and particularly focused on those individuals who do not look like they're handling themselves or in a situation where they can present danger to themselves or danger to each other. And certainly what a lot of people may call or may see as abnormal behavior, or simply behavior that kind of on a regular person basis kind of needs some attention. And so I am very happy not just to be here in this site, but to know that this is part of our expanded level of services. Our city is providing an additional $28 million this year in services that are needed. We have over $2.5 billion a year that are dedicated to social services in the city out of a $9 billion annual budget. And so within the public health, though, we know that we're more than challenged, particularly by those individuals that happen to come into contact with our emergency services well more than once. Now, what Laura's Law does is we want to make sure people know what that stands for. It is, of course, is modeled after a statewide effort that started in the state of Nevada and came to California, where the law requires that each jurisdiction, like San Francisco, each county, pass its own approval of Laura's Law, and then tries to figure out with state agencies, with federal agencies, and with our local partners, how to approach with the involvement of family members of those that might be experiencing these health issues. And the new role here with Laura's Law is that medical professionals working with the families can actually focus on their individual relative and provide input about patterns and practices of the individual, such that a judge and the health professional can service that particular individual, hopefully with a more sustainable approach. It does not require medication at all. What Laura's Law does is it allows a system that, rather than depend totally on the individual's call about what he or she might be personally experiences, but it calls into the involvement family members and others who care for the individual that can weigh in, so that at a hearing with a judge where some of this might happen, there will be some more assessments that are made with the hope that the individual involved can get the right treatment and a sustained treatment that will allow that person to be more successful. Also at this center happens to be not just medical treatment. As you saw, we opened the door to what they call the library, where on a daily basis people are trying to access to jobs. And that we know firsthand that having good jobs can oftentimes allow somebody to recover just as powerfully as family members and the people who really have their interests at heart with that individual, along with their medication or their counseling or whatever the health professionals can properly prescribe. This is what Laura's Law does, is it gets that additional avenue, and we know that there could be very good successes here, but we're also not signaling that this is the answer to everything. I've got to continue working with Supervisor Farrell and the entire board on not only having a healthy budget towards the health challenges of our individuals, but I also have to make sure that we have temporary housing, sustainable long-term housing. We are around the corner at the end of this year. We'll be answering the call on our veterans, on the chronic homeless veterans, and we intend to have 500 additional units on those that are coming through our navigation center, where we help individuals and groups of people hopefully end their homelessness on the streets, and that we are signaling to everyone to take advantage of the city's opportunity while we have a strong economy. Let's get more people off the streets in the right way and get them into proper services and supportive services, as well as into long-term housing. We intend to have the Navigation Center backed up by at least 500 additional units for individuals by the end of this year, and we'll continue working in the larger housing crisis for more housing to be preserved, evictions to be less, and certainly more new housing to be built and rehabilitated in the next 5 years. So with that, I want to just introduce someone who I've had a chance to work with on the board, very effective, and was the leader on the conversation at the board about Laura's Law. Not only did he get the support that was needed, but I think the conversation was done in such a respectful way that everybody in the city is asking, how can I be participating in the Laura's Law to make sure it works properly and to make sure it continues a reflection of what has been and continues to be the tradition of San Francisco, is that we lead by our compassion, and that is the deeper compassion that allows us to do more of this, to spend more of our city dollars, and to make sure we're doing it smarter. We will eventually get to more people on the streets, but we have to do it right. And we're not interested at all in the moving people from one corner to another. That's just not the way we do things here in the city. And we're going to take every opportunity, whether it's conventions, whether it's the Super Bowl, or whether it's our need just to better focus on getting people off the streets for their health reasons, for their own public safety, and certainly for the safety of neighborhoods. I want to introduce, of course, our Supervisor of District 2, Mark Farrell.
Thank you, Mayor Lee, and thanks everyone for being here today. You know, today marks a day after over a year of preparation, a day to celebrate the beginning of assisted outpatient treatment here in San Francisco, but also a day to remember that the hard work is now yet to come. And I want to thank Mayor Lee for his support, for my colleagues on the Board of Supervisors, and the countless individuals and families, organizations both nationally and locally that were instrumental for the passage of Laura's Law and the legislative process. And now we're going to be instrumental as we roll out AOT, or assisted outpatient treatment, here in San Francisco. You know, we have a mental health crisis across our country. In San Francisco, we see it on our streets every single day. And from my perspective, there's not enough that we can do for these individuals, for their families, and for our city to get these individuals the help that they need and to put them on their own 2 feet and on a path to better life. This all started from my view about 2 years ago when I was approached by a number of families here in San Francisco that had loved ones that were suffering from mental illnesses, and loved ones that they unfortunately, after years and years of trying, simply could not help, and they had no tools or resources to be able to help them. And after talking for a while and talking with the Wilcox family, where this law originated, we introduced Lohr's Law at the Board of Supervisors, and with the support of Mayor Lee and my colleagues, we were able to put it through. And it is so important for those here in San Francisco, and when we think about families, to make sure that they have the resources that they need and they feel that they are supported by their community, the city of San Francisco, and that as a city we are doing everything we can for these families to make sure that we help them, because ultimately it's giving a choice and it's making sure that we get those individuals that have mental health issues the help that they need. And when at times the reality is, if they're off medication and don't realize that they have mental health issues, it is a challenging situation for everybody around them. Assisted outpatient treatment is one tool in the tool shed to get these people the help that they need, the medications they need, the treatment, the wraparound services that they are going to receive here in this facility they need to put them on their own 2 feet. And I do want to thank so many people that were involved in this. Joe, who is here, Barbara Garcia from DPH, so many people in our city family. There have been a number of national and, as I mentioned, local health organizations from NAMI and NAMI SF, the Treatment Advocacy Center here in San Francisco. Jess Montejano from my staff was such a leader on this issue, and the countless families that stepped forward to tell their stories, to open up to the community so that we can not only help them, but the next generation of San Francisco families that really deserve this help. This is not a panacea for mental health here in San Francisco or anywhere. It is but a tool in our toolbox as a city of San Francisco, but I would suggest a very important one and something that everybody in our city deserves, and I very much look forward to having it being rolled out and the effects that it can have on our streets. So thank you, everyone, and I want to introduce the woman who's going to be leading our AOT program here in San Francisco for the next few years. So thank you very much.
Thank you, Supervisor. Thank you. My name is Angelica Almeida, and I'm a psychologist with the Department of Public Health and the Director of Assisted Outpatient Treatment here in San Francisco. As Supervisor Farrell noted, this is a new tool in our tool belt to assist and support individuals with mental illness, as well as their families in the communities where they live. San Francisco's implementation of this law is unique and includes a goal of maximizing voluntary participation in services, as well as the adoption of an assisted outpatient treatment care team. The care team consists of a director, which is myself, a peer specialist, or someone who identifies as being a consumer of mental health services, and a family liaison, or someone who identifies as having a family member with mental illness. The two positions, the peer specialist and family liaison, are unique to San Francisco's program, and we feel are important for many different reasons. The first being that we feel that it'll help us be more effective in engaging individuals in the community and therefore reaching our goal of maximizing voluntary participation in treatment. Further, we feel that these positions embody recovery in our program, and all of the services that behavioral health services offer are based in principles of recovery and wellness, or this idea that we believe people can get better, and this is a new tool that we can utilize to help the unique strengths and needs of each individual on their path to recovery. In order to qualify for an assisted outpatient treatment program, an individual needs to meet strict legal criteria, including that they are an adult with a known mental illness who is not engaged in care and is on a downward spiral. They also must have a lack of compliance with treatment that is demonstrated by this either-or statement. Either their mental health has led to 2 or more psychiatric hospitalizations or incarcerations where they received mental health treatment within the last 3 years, or they have 1 or more documented threats, attempts, or acts of violence towards themselves or others within the last 4 years. Additionally, who can make a referral to the program is also outlined in the law and includes an adult who lives with the individual, a family member, which can be a parent, sibling, spouse, or adult child of the individual, the director of a mental health treatment facility where the individual lives, the director of a hospital where the individual is psychiatrically hospitalized, a licensed mental health provider who's providing treatment to the individual or supervising their care, and finally, a probation officer or parole officer who's assigned to supervise the individual on their caseload. Referrals will be accepted beginning Monday, November 2nd, and can be made either verbally or in writing. The toll-free number to make a referral will be 255-4097. Individuals can also review our webpage at www.sfdph.org/AOT for additional information about the history of assisted outpatient treatment and its implementation in San Francisco, as well as information about alternative resources that are available in our system of care, and a referral form that can be completed and faxed or emailed to the care team. Now, while our goal is certainly to maximize voluntary participation in services, we anticipate that there will be a need to, in some cases, to request a court order to order someone into outpatient care. The goal of this court order is to utilize the symbolic weight of the court to leverage someone into care, or this idea that just by nature of having a judge involved in the process, that somebody is more likely to be compliant with the treatment plan. And that is often referred to as the black robe effect. However, I think it's important to note that while a court order may be in place, should someone not be compliant with the treatment plan, they will not be held in contempt, they will not be arrested, and they will not be sent to the hospital unless they otherwise meet the involuntary hospitalization criteria. However, the care team will be working diligently to engage these individuals and offer them services and monitor them to determine if they need a higher level of care, such as hospitalization. Further, individuals who are court-ordered into treatment will be receiving services here at UCSF Citywide Case Management, which is well known for their amazing and well-respected services within the community. While the services that are required are outlined in the law, I think it's important to note that San Francisco has a history of having a strong and robust mental health care system, and that the services that are offered to assisted outpatient treatment clients or those court-ordered into care are also available on a voluntary basis. The goal of this program is really to get ahead of crisis, and it's in line with this idea that we don't need to let people get worse before we help them get better. And again, this is a new tool that we will have in our tool belt to be able to outreach individuals who are at heightened risk for incarceration or hospitalization and to offer them an alternative before they need that level of care. It has been a great privilege to work with this team, and without further ado, I would like to introduce the remainder of our care team, Cedric Fotso and Charles Houston, who will be speaking briefly about their roles within the team. Thank you.
I'd like to thank everyone for being here today. And my name is Cedric Fotso, and my role within the AOT care team is to be the peer specialist. I have a message to share that I'm here right now, and it's very, very important for everyone to understand that living with a mental illness is a constant struggle in the life of a consumer. And given that, it's also very important to understand that stigma is one of the many obstacles to overcome when seeking care. And what is it that we're trying to do as a team? The goal is to reduce the limitation in the face of mental health, and at the same time, AOT will be very instrumental in engaging consumer and on the road to recovery based on their strength and their uniqueness. Also, at the same time, it is also important to understand that trauma is very real and common in the face of mental health. And one of the difficult ways is the fact that in terms of trauma, it's very, very difficult to seek care and to really engage onto the road of recovery when it comes to that. So what is it that we're trying to do as a team? AOT, at the same time, will be very, very instrumental in tackling issues of stigma, and also at the same time to support consumer engage into the road of recovery by sharing values of acceptance and resiliency that are very important concepts in recovery. And at last, the message that I really want to share here today is the fact that recovery is not a destination but a journey. It's very important to understand that recovery does happen, and it does great changes in people's lives. And what we want to do, what is AOT going to be standing for? In recovery, AOT will be very instrumental in supporting and assisting individuals engage onto the road of recovery to be able to reap the benefit of care and at the same time unlock the limitless potential of recovery. And I'd like to end this note by saying that we do recover. Thank you.
Hello, everybody. My name is Charles Houston, and I'm the liaison for families, the whole family. Because when you see that people who take care of their loved ones, they have other people in the family also, such as children and infants. And they're part of the whole team of recovery. So what I'm going to be doing as part of the AOT team is to assist the family in understanding that there's care, that there's hope, and then we're going to work with their strengths. And being a consumer myself of having family members that I saw my parents take care of, and as a child, and then I had to step into the role as a teenager and into the role as an adult. So what we're here to do is to assist the family and to let them know that they're not alone, they've been heard, their needs, their wants, their desires, to help their loved ones in the house, and hopefully that we can help them go on that road of recovery together. And that would be my role with the AOT team, to support the family and their loved ones in the family. Thank you.
Hello, my name is Dave Ferriello. I'm Division Director of Citywide Case Management Programs. We've been, as a program, under the direction of the Department of Psychiatry at San Francisco General for 35 years. And I want to introduce the Deputy Chief of Psychiatry at San Francisco General Hospital, Dr. Mark Leary, who's going to talk about the impact of assisted outpatient treatment on the inpatient and crisis emergency services.
Thank you, Dave. Today's a great chance to recognize the range and depth of services for mental health that we have here for the citizens of San Francisco. I work at San Francisco General Hospital, where we have many services for people with a range of mental illnesses, including two of the more important ones at one end of the spectrum: the Psychiatry Emergency Service, known as PES, and the locked inpatient units on the 7th floor of the hospital. These are outstanding services of which we're very proud, but our goal as a mental health system should be to make these services less and less needed. We're here to celebrate today the opening of the Assisted Outpatient Treatment program in San Francisco, and our mental health system under Joe Robinson's leadership has created this program in a way that gives individuals with serious mental illness every possible opportunity to engage in treatment, to receive care on their own terms in their own community. And it's only when every possible intervention has been exhausted that the court steps in to mandate the treatment that the individual needs. We want people to get the treatment they need in the community long before they find themselves in PES or in the hospital. San Francisco's AOT program is a great program. It's caring, but it's principled, but it's not heavy-handed. I'm really proud of the way our city has created the program, the way it's built it, and I think it will make PES and the hospital unnecessary for some individuals. But I also want you to know that we'll always be there when you need us. Thank you.
So I want to thank you all for coming to help us launch this very important program. I'm sure from the quality of our care team, you can see that we're going to have an amazing AOT program. Our partnership with UCSF, and in particular their citywide division, is going to make this one of the most outstanding programs in the state. We will have our first evaluation due to the state in May, and we will be happy to make that document a public document once it gets approved by our mayor and our Board of Supervisors. We'll be taking questions, but offline. So Angelica, her staff, myself, and a few others will be hanging around to answer any other questions that you might have. And again, a big thank you to Mayor Lee and to Supervisor Farrell for making this possible in this county. Thank you all for coming.